Good morning, everyone, and welcome to the Wired for Logic podcast. I have my guest this morning, Dr. Jessica Drummond. I'd like you to introduce yourself and a little bit about what you do and how you got started in your vertical.
Thanks so much for having me here today, Wes. Well, I started the Integrative Women's Health Institute 19 years ago, and it grew out of my work as a clinical physical therapist. And eventually I got a doctorate in clinical nutrition. So I'm a physical therapist and a nutritionist. Most of what we do now is about, almost all of what we do now, although we do have a small practice, is about educating my colleagues in women's health. And we were the first and only women's health coach certification globally. We've trained, I think something like 5,000 professionals around the world now. And the reason that I stepped into doing this work is that my tools individually as a physical therapist or even as a nutritionist were limited to help the people with the most complex conditions. Things like endometriosis, bladder pain syndrome, vulvodynia, like severe chronic pain syndromes that we now understand are actually chronic systemic issues that also have to do with things like hypermobility and mast cell activation syndrome and dysautonomia and chronic fatigue. And so when we were approaching these things back in the late 90s, early 2000s, we had very few tools. And our physical therapy tools were helpful, but they weren't getting to the root. The surgeries that were being done for endometriosis at that time were very limited. The surgical techniques have come a long way. And unfortunately, because of how everything was set up around pain management at that time, many of our patients were addicted to opioids. So we had to really innovate and evolve and come to this with a very broad perspective and started to look at systems health. So instead of like finding a disease state, if you will, and then sort of like shutting down the symptoms, we had to learn how to system by system, immune system, digestive system, nervous system, musculoskeletal system, optimize each of those physiologic systems so that all of the different symptoms could be addressed. And so I started teaching this to my colleagues back in the early 2000s. And, since we have the internet, of course, now.
You're really digging into the root cause then, not just treat the symptom.
Exactly. So we started that conversation, which of course, has expanded quite a bit since then.
Yeah, that's interesting. It's kind of, I appreciate that approach because it's easy to treat the symptom. Oh, if you have pain, just take pain medication and you numb the pain, but that's not actually fixing the problem. It's kind of like in our field, with technology, if the computer is acting up, you restart it and that fixes 99% of the issues. But why is it happening in the first place? Because if it just keeps happening, then we keep getting a call from that client and then that client gets frustrated because, my computer's messing up all the time. It's like, well, computer's also 5+ years old. Maybe it's time to get a new computer. That could be the root cause right there. But with our bodies, you can't just go get a new body. It's you got to work with what you have. So yeah, that's interesting. I was talking with a gentleman the other day, Dan DeFigio, I believe. I don't know if that name rings a bell or not. He's also an author. I don't know if you author types hang out together and know each other, but he wrote a couple books. He's focused a lot on reducing or removing sugar from your diet, and that can solve a lot of dietary issues and weight gain and things like that. And he was sharing a story with me about how he had a little girl. A family brought this little girl to him, and she was struggling with weight loss. And he was, to him, and probably to you, when you see a symptom or a health issue, you're like, oh yeah, I know exactly what that is. The same thing with him. He's like, oh, it's this, this, and this in her diet. Remove these items, and all of a sudden, it's healthy, and gradually the weight would come off, and the little girl was back to a healthy weight and not obese. So it's very interesting. What do you see the most of currently these days in terms of health issues? Is that different than you saw 10 years ago, or do you see some kind of trends, or how does that look like for you?
Yes, I think there's a couple of things that we much better understand now than when I started doing this work, particularly in nutrition. So this idea of elimination diets, if you will, like removing sugar. Sugar is a little bit of a different conversation because it's not actually a food. Like we don't need sugar, but like there are a lot of elimination diets that will eliminate certain food categories. And that was sort of a trend for a while. And there's some credence to that in the sense that if someone has a a really dysregulated immune system. Certain foods irritate the immune system. And so giving the immune system or the digestive system, which are very well interconnected, removing those for a period of time can be really helpful. But we have to look underneath why people are eating those foods. And a lot of times there's emotional issues related to that, trauma. And so we can't just give a checklist of what not to eat
Right.
without figuring out why that person is eating those foods, what positives they're getting from them so we can get them from somewhere else, fit it into their lives. I work primarily with perimenopausal women. So women in their 30s to 60s are super busy. So they have to learn how to cook and they have to fit it in with what their kids will eat. And so we have to think about all of these things as much more holistic, not just this is what's not to eat. So I would say we've evolved in our understanding of nutrition to understand that elimination diets and even things like fasting and intermittent fasting have a place in terms of healing the immune system. But we have to always put it in context of the unique client and her family and her stressors. And then
Right.
the second thing that obviously is a huge issue now, there's a lot of conversation about perimenopause. But women in perimenopause are about 45% more likely to also have long COVID. And in fact, after the third infection, 40% of people will get long COVID. So, and that can look very vague unless you know what you're looking for. And so obviously that has changed quite a bit in the environment. So most people that maybe just had Hashimoto's or just had sequelae from perimenopause or just had endometriosis, all of those things, which in and of themselves can be a huge problem if it's something
Right.
that you have. Now we layer post-COVID and post-viral infections. Sometimes it triggers EBV, sometimes it triggers CMV. We have to take that into consideration now because most people by now have had at least 3 infections. So 40% of them will also have long COVID at the minimum.
Yikes. Yeah, that's no joke. Some of the brain fog and things that come along with that. Yeah, it's not great. COVID
Yeah.
has definitely been an interesting animal and how it affects everyone differently. I remember thinking when we were going into 2020, I was like, man, this is going to be the best year ever. And it was a great start to the year until it wasn't. And then everything kind of went downhill. I remember in, there was a huge shift in work from home because of that. And we had to scramble very quickly to help our clients adopt a work from home strategy.
Mhm.
It worked better in some cases than others, but it really depended on how cloud dependent they were. If they were very heavy in the cloud already,
Mhm.
then it was easy for them to do work from home. But if they
Mhm.
weren't, then it was scrambling to, hey, let's get you migrated to the cloud as quickly as possible. Let's get you guys using Teams for communication or Google Chat or whatever, depending on what platform they were on. But yeah, it was interesting.
Yeah, I was supposed to go on a book tour in March of 2020. That
It's like
changed
the
quite a
year
bit.
everyone wanted to end by like February,
Yeah, yeah.
What did what percentage of clients do you see that you have long COVID, and what symptoms do you look for to determine whether it is long COVID or not?
Well, my practice is quite long COVID heavy now because I talk about it a lot. And as I mentioned, it very commonly overlaps with the things I was already commonly seeing. So perimenopause transition, endometriosis, hypermobility, MCAS, dysautonomia, chronic fatigue, autoimmune diseases like Hashimoto's. For me, that's a lot of the clinical work that I do and even a lot of the teaching. The symptoms are widely variable because it depends, as you said, on how the infection impacts a person. Does it reawaken prior quiet infections like EBV? Does it cause direct organ damage that we have to deal with, like a heart injury or an ovarian injury or, a thyroid injury or something like that? Is it vascular damage? Does it irritate the immune system? And of course, we still have quite a lot to learn about COVID and long COVID, but some of the theories that are getting clearer and clearer is that it's likely driven by either one, the acute organ damage happens in everyone. We know that even people who
Right.
don't have long COVID actually have brain injury from each COVID infection. So we have to I think of COVID now, more as an injury than an illness, although it is a little bit of both.
Right.
So anyone who ever has COVID should spend at least 3 months rehabbing their brain, whether they feel it or not. So imagine you had a concussion. Then the second thing that's most commonly seems to, the literature, we still have a lot of work to do in the research, but many people have reservoirs of COVID or COVID proteins in their bodies for, up to 5 years now, as long as we've had COVID. So that changes the immune system. Also, each infection injures the immune system a bit more. And for some people, that's really hard to recover from, depending on how injured their immune system was before. So it's both that the virus is still persisting, but also that the immune system is changed and damaged in a way that can be hard to recover from. And so it depends on kind of where their injury shows up, because it's kind of like, someone could get in a car accident. One person could have a head injury, one person could have a broken arm. Like, COVID is the car accident, and it shows up
Right.
differently in different people.
What are your recommendations for recovery from things like COVID, specifically for the brain, to help maybe reduce some of that brain fog? Do you have any recommendations for that?
Yeah, so you think of it as both, it's two issues are happening. Inflammation to the brain. So immediately shifting to, if you weren't already, which ideally you should be anyway, most people should be living on an anti-inflammatory diet, but most people aren't. So if you
Right.
could shift to an anti-inflammatory diet, which is primarily fruit and vegetable heavy proteins, low in sugar, processed grains, sometimes any grains at all if we need to take a break from that, using more omega-3 fats like fish oils and olive oil. Well, olive oil is not directly omega-3, but like, less omega-6 fats, which are things like processed seed oils. Not that those are entirely forbidden, just like sugar, but less is more, and much less is more when you're in an acute healing state. So I would let go of sugar and, no processed meats, things like that. Alcohol, take a break from alcohol for at least 3 to 6 months. And then the other thing that we have to be careful of is in athletes in particular, we want them to be really mindful of how they return to exercise, because the mitochondria can be damaged by COVID. And we've learned that people who go back to exercise too quickly without healing the mitochondria, which is a similar strategy, it's an antioxidant strategy. So things like CoQ10, PQQ, NMN, these like precursors to nutrients that are required, precursors and nutrients that are required by the mitochondria. Again, more color in the diet, green tea, olive oil, all the things we think of with like a Mediterranean diet, salmon, things like that. So we have to recover the mitochondria and sleep as much as possible for the 3 months during and post an infection. And, some people need a lot longer, but like assuming someone was healthy and athletic, 3 to 6 months is like a recovery time from a mild COVID infection. Something that just felt like a cold is actually doing damage to the vascular system in the brain. And so the
Oh,
second thing is actually increasing oxygenation to the brain. So we have to think about vascular health, hydration, gentle like circulation movements. We want to make sure people are not just laying in bed. We want them moving, but they might have to move more gently on like a low, intensity stationary biking or walks in the woods, not like high intensity interval training, for example. So I think one of the things that's really helpful in this stage of the COVID pandemic is to just test yourself every time you have a cold. Like, it's important to know if you had COVID or not, because we do have treatments for COVID now, which really help lower the amount of virus that your body is having to deal with. So it helps that recovery more quickly.
interesting. It's called CryoFit. They're
Mhm.
rebranding as BioWorks, but I'll go in there like once a quarter and get NAD plus IV.
Mhm.
I feel it's beneficial. What are your thoughts on supplements like that?
Yeah, I mean, NAD is one of those nutrients for the mitochondria. I have found that for people that have more acute issues where their mitochondria is less resilient in the moment, actually, I prefer using nicotinamide mononucleotide, NMN, which is like a precursor. You can take it orally. We combine it with resveratrol, which is a really good antioxidant. And it's just a little less side effects. So NAD sometimes can give you that like chest pain and abdominal pain. It's a little bit aggressive of a therapy. Now, some people have the physiologic resilience to tolerate that, but for the people that I'm working with, they're usually a little sicker. So we start with NMN, which you can take relatively high dose for a while, and it's just gentler. It doesn't have the side effects of NAD.
Yeah, I definitely notice when the drip starts, and it kicks in. My wife, she has to do the bag over like a 2 hour, 2.5 hour period. I've blown through it as quickly as like 45 minutes to an hour, like a 500 bag. And they were just like, oh my gosh, like I've never seen anybody blow through a bag that quickly. But I had to
Right.
get in and out of there. I had something else I had to do, but I also needed to get my NADs because I try to do it once a quarter and be kind of religious about when I'm doing it. So it's on somewhat of a routine. I feel like it helps.
Yeah, I mean, like I said, it adds that nutrition to the mitochondria, and my my guess is that if you're an entrepreneur, having been an entrepreneur for 20 years, like you're busy,
Very busy.
adding that level of support preventatively is a good idea. But like I said, I would probably do it more gently in most cases, but obviously you're tolerating it well. So seems fine to me.
Yeah. Speaking of anti-inflammatory, it's not so much for the brain, but it does help me kind of reset mentally. They also have a cold plunge in
Mhm.
there, and I love doing the cold plunge. Staying there for about 10 minutes, and you're overriding your body's natural survival instinct. You see the temperature on the water. You don't want to get in the water, but then once you're in the water and you're in it, after that first 3 minutes, it is what it is. I stay in there about 10 minutes or so, and it really kind of helps me reset. I like to go in the middle of the day.
Mhm.
So get through the morning, go and do a plunge, kind of reset my brain, and then kind of go into the afternoon with a fresh mind. I feel like it kind of helps. I'm not sure what all chemicals, I'm sure adrenaline and other things get released into the brain. It's helpful for me. What are your thoughts on things like that?
Yeah, I do like cold therapy, and actually heat therapy is also really important. So things like sauna is super valuable. For women, I think we have to think of it slightly differently. So women, we have to be mindful of their cardiovascular health before we put them in a cold plunge. It's better to start with contrast baths, or like a 1 minute cool shower, 1 minute warm shower, 1 minute cool, 1 minute warm, ending in cool. And cool, not like icy cold, until they're trained, because women's heart attacks are different from men's. Men's heart
Interesting.
attacks tend to be related to like the traditional, what we think of as a heart attack, right? An atherosclerotic plaque that travels to the cardiac vessel. In women, the heart attacks are related to arrhythmias more often. And so jumping in a 10-minute, like icy cold plunge could trigger a heart attack in women. So it's more likely to in women than in men. And
Interesting.
so we have to be careful of that until they're built up that tolerance. But, if you've been doing contrast showers for a while, and then you start in a moderately hot sauna, and then you go in a cool, I had a sauna in the house we just moved out of, and then we had an outdoor shower. So you do a sauna for anywhere from 10 to 20 minutes. Then you can do a cool shower, not icy. But eventually, I did that for probably a year, maybe a year and a half. And then we were in Finland this past summer, and, their saunas are 200 degrees, which is the evidence-based number, over 170 to 200 degrees.
Oh,
Though there is some benefit of cooler saunas, so slightly less hot. And then we jumped in the North Sea, which was like freezing cold. And that was probably the best I've ever felt in my life. So there's a lot of anti-inflammatory benefits, but there is also the brain neurotransmitter release that you're talking about that is very nourishing as well.
yeah. One of the ladies that works there, she does do the contrast therapy, and and I've noticed this too. I've lost quite a bit of weight over the last year, and I've had a harder time recovering from the plunge. Like it takes me longer, I guess, because it's less body fat, and my body's still trying to adjust to regulating
And so
temperature.
it might be that actually, so there's a level of hormesis that we don't want to push past. Like there's a lot of cool factor of being able to be like in it longer and colder, but that's not actually always the best benefit, because sometimes you're actually triggering then a stress response that could be causing more harm than good.
That makes sense.
hmm
Well, as we come up on 5 minutes, what are your kind of closing thoughts or recommendations for women in general in terms of health? As they get older, we all get older. We deal with different health issues. what are some of your recommendations that you would have for our listeners?
Well, I think, as I mentioned, we train professionals primarily in perimenopause health, and 87% of them also have some kind of chronic illness, whether it's an autoimmune disease, migraines, history of endometriosis, et cetera, et cetera. And so there are the lifestyle foundations that, generally are kind of thought of as like fluffy, like walk, practice mindfulness, have a bedtime routine, eat an anti-inflammatory diet that's primarily based in colorful fruits and vegetables with a fair amount of protein and fiber. These foundational day-to-day lifestyle habits are both preventative and actually help in recovery, because anything we layer on top of that, whether it's a supplement stack, cold plunging, hormone therapies, all of which have value, have exponentially more value if you have these foundational lifestyle habits in place. And that's very difficult to do for women in their 40s. So working with someone who's a coach who can help you with organizing your time, learning to delegate, working on your boundaries, making sure you have the team member to help unravel your trauma, all of those things are essential so that you can even do these lifestyle strategies in a world that's just increasingly busier and more stressful. So you need that support, but then doing those day-to-day habits is actually so valuable, particularly in the environment that we're currently.
That's awesome. Well, I really appreciate your time today and thank you for coming on and sharing some of your insight. You also, I know you're an author as well. I don't know if you want to plug some of your books that you've written or tell our listeners how they can find you and get more information on what your services are.
Sure. So if you want to follow us, our website is integrativewomenshealthinstitute.com, on Instagram at Integrative Women's Health. And my most recent book is called Outsmart Endometriosis. It's still on Amazon Kindle. You can get it. It's not very expensive, but that gives you sort of that deep dive, step by step, like what are the lifestyle habits that we need to use, particularly if you have a chronic autoimmune inflammatory disease like endometriosis. It applies for any disease that's similar to that, such as any autoimmune disease as well.
Awesome. Well, thank you for joining us today. I really appreciate your time and it was great chatting with you. Foundations are always important. And I think starting with that, like your recommendation is build that foundation, build those good habits, and then layer other things on top, like some of those recovery strategies, sauna, cold plunge, other supplements, and things like that that you're talking about. Thank
Absolutely.
you
Well,
again for
thanks
your
so
time
much.
today. I really appreciate it. And I hope our listeners enjoyed.
Thank you so much for having me.